The multicultural reality we described in the last presentation and its growing complexity represents some serious challenges for healthcare. First, let's think about those challenges related to the patient-professional relationship. We've already seen how significant and how difficult high-quality communication is between patient and professional in the medical context. It is often difficult for patients to communicate effectively their symptoms and even more significantly, their values as they work with healthcare professionals to discover the best course of action in the face of a health crisis. Imagine how much those challenges increase when the professional and the patient speak different languages and their communication has to be done through a translator. Or even if both speak English, one or the other may be speaking English as a second or third language and lack the level of proficiency they have in their original language and the level of proficiency necessary to speak and to understand complex subjective matters like those we deal with in healthcare. Of course, there's diversity among healthcare professionals and not just among patients. So don't think about this just in terms of an English-speaking physician or healthcare professional working with an Hispanic patient. Imagine a Chinese-American physician who's working with an Hispanic patient. Both are communicating in English, but English is a second language or may well be a second language for both. The challenges to communication in the professional-patient relationship go beyond issues related simply to language, however. Language is only one aspect of culture, even though it may be the most important. When we think about cross-cultural communication, we are also thinking about matters related to different worldviews, different values, different styles of communication. People from different cultural backgrounds bring different understandings of health and sickness or disease, different ways in which scientific knowledge or data is assimilated into other aspects of a person's worldview, different ways in which religious beliefs and scientific data are merged, different beliefs about the meaning of life and death. All of this adds significantly to the challenges of communication and adds significantly to the challenges to the professional-patient relationship. Cultural diversity often interacts with political, economic, and social inequality. We will talk later about health inequities among various racial and ethnic groups. At this point, where our focus is on the professional-patient relationship, it's enough simply to note that many immigrants and people of color are also wrestling with issues related to poverty, a lack of social standing, and diminished political power. Of course, those realities also impact significant numbers of poor and working-class white people. Poverty, a lack of social standing, and diminished political power also affect the professional-patient relationship among folks who share a common culture and language. Trust, of course, is essential to the professional-patient relationship. But where communication is difficult, where there are obvious differences in worldviews and values between professionals and patients, trust is undermined. Where patients are poor or lack social and political status, uncertainty, suspicion, and mistrust are inevitably brought into the relationship. I'll be asking you to look at some vignettes from a 4-part video series called Worlds Apart. You will look at 2 this week and 2 more next week. The first involves an Afghan man named Kochi, who's been diagnosed with stomach cancer, who must decide about chemotherapy amidst problems of communication due to both translation issues and different religious convictions. The second is about Chetsina, the mother of a 4-year-old girl from Laos who's caught between physicians who tell her that her daughter needs surgery to correct an atrial septal defect, and her mother, who upholds traditional Khmu beliefs that scars, including surgical scars, are injurious to a person in future lives. She's trying to negotiate that conflict between a medical culture and her own traditional Laotian culture. Next week, you will view and write a discussion board post about 2 other vignettes from Worlds Apart. The third video is about Philip, an African-American man on dialysis who discusses the prejudices against black people in the healthcare system, particularly his decreased chances for receiving a renal transplant, he believes. Finally, we meet Mercada, a 60-year-old Puerto Rican woman who lives in Hell's Kitchen, New York City. She explains the complex social situation which affects her ability to take care of her chronic health problems, such as diabetes and hypertension. I'm also asking you this week to spend 45 minutes each on 2 learning modules related first to understanding culture, and then secondly to developing cultural competence and cultural humility. Your discussion board assignment will be to identify 2 really key insights for you from each of those modules for a total of 4 key insights. And then in the discussion board post, I ask you to apply those insights to one of the 2 vignettes from Worlds Apart that you watched previously. I think this week will be fun for you and will certainly be important in terms of developing your understanding of the cultural complexity or the challenges of cultural complexity in healthcare.